Hello, everyone. My name is Nita Gupta, and I'm a Pediatric Emergency Medicine Physician at Children's Minnesota. Today, I would like to talk to you about pediatric reunification and what parents need to know. This video is specifically tailored towards parents, but these are tips and terms that may be helpful to all emergency management professionals. I'm part of a larger nationally funded collaboration by the Department of Health and Human Services under the Administration for Strategic Preparedness and Response, also known as ASPR. I represent Minnesota in our Center of Excellence called Region 5 for Kids. This Center of Excellence encompasses all 5 states in our FEMA 5 region, which includes Indiana, Illinois, Michigan, Minnesota, Ohio, and Wisconsin. We serve over 3,000 pediatric beds with over 600,000 annual pediatric emergency department visits. ASPR has 3 nationally funded centers of excellence. FEMA Region 5 is one of them, which we are a part of, but we also have RAPM, which is our Western Alliance, and G7, which is our Gulf 7 Alliance in the South. The red circles represent the Pediatric Pandemic Network, which is another network of children's hospitals working closely with the EMSC. So what does the term reunification exactly mean? Pediatric reunification is the process of reconnecting separated children with their parents, caregivers, or legal guardians after a disaster. Disasters can strike at any time of day and night. Typically, during the day, children are naturally separated from their parents as parents are at work and children are at school or daycare. Depending on the age of the child, they may not have proper identification or even have the developmental skills to self-identify. It is therefore imperative that all pediatric facilities, whether it's a daycare, school, hospital, or community facility, have a pediatric reunification plan in place. Families should also have their own plan in place before a disaster strikes so that they can feel better prepared for an emergency situation. I wanted to provide some examples of exactly what disasters are so that parents can understand what scenario they are preparing for. Disasters can be natural or man-made. Some examples of natural disasters are tornadoes, floods, rainstorms, wildfires, volcanic eruption, drought, earthquake, landslides, or snowstorms. Man-made disasters are things like mass shootings, bombings, or chemical warfare. The Centers for Disease Control and Prevention, commonly known as the CDC, have a backpack emergency card. You can download this for free from their website and fill it out. It's a simple measure you can print and place in your child's backpack for easy identification. Once your child is old enough, you can then teach your child their name, and your phone number. It's also important to have an out-of-state contact and a phone number that's also out of state in case there's a large-scale disaster in which you are unreachable by emergency personnel. If you are a parent of a child with special healthcare needs, there is an emergency information form for children that includes essential information about the child's medical history. Have this form pre-filled and included in your family readiness kit, or have a copy of this with your child at all times in their backpack. This form can be found for free online by the American Academy of Pediatrics. Besides for forms, there are certain measures you can also take as a parent. Always have a recent picture of yourself with your child, so you may use this as a form of identification. You can have this simply on your phone. Always have digital copies of passports, ID cards, birth certificates available if you are unable to reach the hard copies that may be in your house and due to a disaster, you're unable to reach your house. The Family Readiness Kit, provided by the American Academy of Pediatrics, also provides excellent pre-disaster planning tips for what kind of food, clothing, items you want to have ready to go in a go bag in case a disaster strikes at any time. During the actual disaster, your main concern as a parent is where is my child and are they safe? If a disaster strikes, emergency response, paramedics, and local law enforcement will take your child from the incident location and take them to the closest emergency room. There may be a chance your child goes to a different local emergency room, especially if it's a large-scale incident. Once at the hospital, your child will be registered as an unaccompanied minor using any available identification on them. This could include what they're wearing, what accessories they have on them, such as jewelry, or even a distinguishing birthmark. After the patient is seen by a medical provider, if they require further medical attention, they will remain admitted to the hospital. Social workers will work in close communication with law enforcement to find you as the parent for the patient in the hospital. If they require no further medical attention, then they will be sent to a location called the Pediatric Safe Area. This is a separate, secured area within the hospital for all medically cleared children awaiting reunification with their families. This pediatric safe area is supervised by hospital employees, such as social workers, child life specialists, who have all completed background checks, and current hospital employees. The pediatric safe area has plenty of food, baby toddler safe areas, child activities, and a secured separate bathroom to keep the child safe and occupied while they're awaiting family reunification. Many hospitals will be expecting worried parents to come in person inquiring about their missing child. Hospitals will direct you to their Family Reunification Center, which is an on-site designated area where you can register your contact information as well as your child's demographic information so that they can make a match. With the information you provide, they will determine if your child is admitted to their hospital for further medical care, waiting in their pediatric safe area, or is located at a different hospital. At the Family Reunification Center, they will have an organized check-in process with sign-in and sign-out sheets with your contact information so they can contact you, as the reunification process could take days. When coming to the site, you will want to bring a photo of you and the child so they can use this for their records. Any identification cards, passports, or birth certificates will also be helpful. At times, depending on the type of disaster, you may not be able to go to the reunification site in person, especially if you yourself are injured or if the area around the hospital is unsafe. Hospitals may have the same registration forms available on their hospital website for you to fill out online or by calling in to inquire about that information. They may ask for the same information or reach out once a match has been made. Consider going to the hospital website or calling the main line to hear their pre-made messaging system, which may provide up-to-date information about the reunification process so that it may save you some time. If the reunification process exceeds more than several days, a family assistance center may open up from the community, as well as the reunification center by the hospital. The Family Assistance Center functions very similar to the hospital-based Family Reunification Center, but is organized by communities instead of the hospital. Once the Family Assistance Center opens, the Family Reunification Center may slowly close down, depending on the length of the reunification process and the hospital's resources. Public media and social media will be updated with information regarding the Family Assistance Center's location. Here are some examples on how facilities may confirm identification of you with your child. If your child is old enough, they may identify themselves with you as the guardian with a photograph or by just saying simply their name and your name. You can also bring a photograph in which you are with your child that you provide to the Family Reunification Center. They can also make a match based off of the information you provided on the form online, on their website, or in person or over the phone. Or lastly, and most costly, they can do it via biometrics, such as DNA sampling, fingerprinting, and palm printing. This option is usually available by hospitals if they're unable to reunify in a timely manner. After the disaster has occurred and you are reunited with your child, there are, of course, a lot of emotions. Mostly you're feeling relief. However, children may react differently post-disaster than adults, and it's important to take this into consideration. Children learn from their surroundings. Thus, if parents have a calm and supportive environment, then the children will also respond similarly. Immediately after the event, limit access to repeated images about the disaster from the public and social media as best as you can, as this can trigger emotions and increase the stress of the child. Allow the child to lead the conversation. Encourage them to ask questions, and you follow their command for conversation. Whatever they ask, you respond. When providing your explanation, keep them short, simple, and direct. As the days go by from the disaster, it's important to try to return to normal activities as soon as possible to maintain a routine and get the child back into their daily lives. Children will feel a loss of control after disaster, so consider involvement in the community for victims in the disaster, such as local food shelters, donating items, or even joining a local community group to help them cope with this. Make sure you are monitoring their emotional health in all settings, including home, school, and other activities. If you're noticing any stress that's limiting the child from returning to normal activities, then consider going to your healthcare provider for further evaluation. If anyone would like more resources for pediatric disaster planning, this is the Ask for FEMA Region 5 for Kids website, email, LinkedIn, and Twitter. You can scan this QR code and it will take you to our main page. We will soon have a Facebook and Instagram account as well that you may follow to keep up to date about pediatric disaster preparedness. These are my resources. Thank you for listening, and I hope you have a better understanding of pediatric reunification during a disaster.